Good day everyone. Today we'll be discussing the thoracic surgeries. Mainly the thoracic surgeries include the surgeries of the parts which are in the thorax, mainly lungs, the pair of the primary bronchi, heart, esophagus and diaphragm. So talking about the pulmonary surgeries means the surgeries which are including the lungs. So main indications for these surgeries are bronchial carcinoma, malignancy, either primary or secondary, the lung infections, pulmonary diseases like cystic fibrosis, bronchiectasis, chronic bronchitis, emphysema, or the chronic cases where the bullae formation is there. So we can perform a pulmonary surgery. Another indication could be trauma, any blunt trauma or any penetrating injury like gunshot. And lastly, the congenital causes could be the indication for pulmonary surgery like arteriovenous fistula, lobar emphysema. So whenever we discuss the pulmonary surgeries, we have to deal with the term thoracotomy. Now the thoracic cavity is approached by various thoracotomies. Thoracotomies that are the incisions leading to the thoracic cavity to gain access to the lungs, bronchi, heart or esophagus. And the position of incision relative to thorax, it may be lateral or anterior. And it can be further subdivided. If it's lateral, it can be further subdivided into anterolateral and posterolateral. And for the anterior, it can be divided into transverse or vertical incisions. Now, talking about the posterolateral thoracotomy or the incision, this is the most commonly used incision for any pulmonary surgery. So, its extent is that it starts from the medial border of scapula, moving around the angle of rib, that is 5th to 8th rib, and it ends towards the costal margin of the rib. The main muscles which are cut during this incision are trapezius, latissimus dorsi, serratus anterior, rhomboids, erector spinae, internal and external intercostals. Also, sometimes in this incision, a rib or few ribs may be resected or removed so that the other ribs, they are retracted and there is sufficient space for access to the thorax. So this is the posterolateral incision starting from the medial border of the scapula, moving around the angle of rib, that is 5th to 8th rib, and it ends towards the costal margin of the rib. So another lateral incision or thoracotomy is anterolateral incision. So its extent is start from the midline and it follows along the line of the rib to the posterior axillary line. This incision never goes beyond posterior axillary line. So it starts from anterior part and it moves backward towards the posterior axillary line. The main muscles cut during this incision is pectoralis major and minor, serratus anterior, internal and external intercostals. So mainly this incision, it is used for mitral valvotomy and pleurectomy. So we discussed the lateral thoracotomies, anterolateral and posterolateral thoracotomies, and these both are used in pulmonary surgeries. Next we will be discussing the anterior thoracotomies. So when we talk about anterior incisions, there are two incisions. One is transverse or submammary incision. In this, the incision passes around the one side of the fourth intercostal space to the other. Right? So this is almost from fourth intercostal to the other fourth intercostal. So this is transverse or submammary incision. The muscles cut are the pectoralis major, intercostals, and in this the sternum is divided transversely. This is not very often used incision. Next incision we'll be talking about is again the anterior incision, that is the vertical or median sternotomy. So this involves splitting of the sternum down the middle. Mostly no muscle is cut in this incision other than the interweaving aponeurosis of the pectoralis major. And this incision, it is used for open heart surgery. So this is median sternotomy, and it is very commonly used when there is surgeries related to the heart. So these are the incisions which are mostly used in the thoracic surgeries. Include lateral, anterolateral, posterolateral, anterior approach, that is transverse, and vertical. Now next we'll be discussing about the types of operation. So talking about the pulmonary surgery, first will be the pneumectomy. Pneumectomy means the removal of the entire lung. Second is lobectomy. Lobectomy means the removal of the entire lobe. And third one is the segmental resection, where there will be removal of the bronchopulmonary segment. And lastly, the wedge resection. Wedge resection means removal of any small part of the lung tissue. It is usually a non-anatomical resection, and it could be used for diagnosis or any treatment of the localized peripheral carcinomas. In next video, we'll be discussing these operations in detail. Thank you.